the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today in the show, we have Joe Miller. His book, The Vaccine, Inside the Race to Conquer the COVID-19 Pandemic, is excerpted on Kevin MD, and he is now joining us on the show. Joe, welcome to the show.
Great to be with you, Kevin. Thank you.
So we'll get into your book in a little bit, but first off, can you just briefly share your story and journey to where you are today?
Sure. So I am the Frankfurt correspondent for the Financial Times. I've been here in Germany since 2019. Before that, I worked for the BBC around the world. My job here is to cover German industry. So mostly I cover German car makers and steel makers, etc. And that's why at the beginning of 2020, I was slightly more alive to COVID-19. It wasn't called COVID-19 then, of course, yet, than other people, because a lot of the companies that I cover, they have large plants in China that were suddenly being shut down by this mysterious virus. And I was trying to find out a little bit more about this and what was going on. And someone in London at the FT pointed me towards these companies who were, going to be developing or trying to develop a vaccine. And as I'm sure you remember back then, there were hundreds of companies trying to do this. But I stumbled across this one company and thought, hey, they sound kind of interesting. And I got to say, I'd be lying if I said that I knew that this was going to be the company that ended up partnering with Pfizer and creating, this vaccine, the first and now the most ubiquitous COVID-19 vaccine. I really thought that this guy who ran it, Uğur Şahin, was just an interesting guy. And I thought I would follow him for a few months and then I would write a story about how difficult it is to create a vaccine and how they failed and how, most people would have failed at this and, the struggles that they went through. And it was really only, June or July, sometime in 2020, when Uğur called me on one of the calls and he said, Joe, it's really as good as it gets. And he was referring to some of the early data that come out of the clinical trials. And then I thought, oh my God, I better start looking into this in detail. And so I really upped my reporting on the company. I spoke to dozens and dozens of scientists, the regulators, the politicians involved. And that's how this book really came about.
So, of course, now everyone knows BioNTech, but tell me about this company before COVID. What were they specializing in and how prominent were they?
Well, there's a reason that I hadn't heard of them before COVID, and that's because they're based firstly in Mainz, which is about 40 kilometers from where I'm sitting here in Frankfurt. And Mainz is not one of the big centers, as you'll know, of biotechnology. It's not Boston, it's not Cambridge. It's nothing like that. And this company was small. It had just listed on the NASDAQ a few months earlier, and it was mainly focused on cancer therapies. And when I say mainly, they had 1,200 employees at the time, of which 15 were focused on infectious diseases. So really mainly a cancer immunology company. And it was sort of seen in the same group as CureVac and Moderna at the times, trying, had a pipeline of mRNA products, but was nowhere close to even a phase 3 trial, never mind a, approved or licensed pharmaceutical. But they were extraordinary in that they had two, very unique investors who were long-term. And so they were operating on a different kind of time frame to many other biotechs around the world, in that they had just basically stuck with this technology and been working at it for so long. And that, in the book, is one of the reasons why they got there first, because of, this sort of long-term view that they had. But it's really fair to say that they were probably among the most unlikely, at least on paper, companies in the world to have been, the progenitor of the COVID-19 vaccine, the first and most successful one.
So with the mRNA technology before COVID, why were they studying that technology for so long? What conditions did they hope to treat with the mRNA technology?
So what's interesting about them is that unlike many other biotech companies, Uğur Şahin and his wife and research partner, Özlem Türeci, who co-founded the company, they're both clinicians. So they started off as doctors and they started off as oncologists. And they were, like many, really frustrated in their early days they worked on a hematology ward and were just frustrated by the lack of options of treatment of their patients and how many of them were dying. And they came together on this quest to find a cure for cancer, a treatment for cancer. And they felt that mRNA, even though at the time, this was the early 90s when they were getting together, it was, as you probably know, a very ridiculed molecule in many ways. And I say ridiculed because people did say really, nasty things about those who were interested in pursuing it, because it's so volatile, because it's so difficult to protect. They thought that those people who are trying to create drugs using mRNA were essentially out of their minds. But they saw that this that they saw the potential of being able to harness mRNA to essentially, they call themselves immune system whisperers, to essentially recruit the immune system and all the forces of the immune system to their cause, which was at the time to fight tumors. And so convinced were they that this was, of the benefits of this technology, that they spent decades working on it. But I must say that it's not just them who spent decades of it, it's lots of different people around the world, some of whom have now become quite familiar, like Katalin Karikó, who fled from communist Hungary and was at UPenn and was working on this with Drew Weissman, and people in pockets around the world. And what's quite interesting is that some of them didn't even know of each other, but they all sort of built on each other's work, and all of this sort of reached a crescendo around 2020. And we really, really are very lucky that COVID-19 emerged at the beginning of 2020, because we just got to a point where mRNA had been combined with lipid nanoparticles, and we got to just the right point where we could protect the molecule for long enough for it to reach the required cells, the dendritic cells, in order to create enough protein to have a successful vaccine. So what was unique, is that they stuck with this, but also there's a lot of serendipity involved in this story, much more than you'd think when you start off with it.
All right, let's talk more about your book. It's titled The Vaccine, Inside the Race to Conquer the COVID-19 Pandemic. So, Joe, what are some of the key points that you want readers to come away from after reading your book?
Well, the first point really is just how unlikely this story is. Right from the beginning, I start with this tale about this guy, Uğur Şahin, who's sitting at his computer on January the 24th and reading the Lancet. And he's doing calculations based on this earlier report of some, what we now know to be COVID patients, but then we didn't know to be COVID patients arriving at a hospital, and the early tests that were done. And he then goes on to predict on January 24th exactly what would happen in the pandemic, exactly. And when I say exactly, I mean, how quickly, which places it would spread to first, how infectious the disease would be, et cetera, et cetera. And when I was writing this, I was so concerned people would think I was making this up, because it's so prescient. But really, I know it's true because I've seen the emails from, contemporary emails, and, I only got in contact with Uğur a month later, but even in February, it wasn't clear that this was all going to, play out the way it would. And he was telling me this is how it's going to happen. And I have those, recordings. And he was saying to me, it's possible to do a vaccine in a year. But the main thrust of the book is also all of the other unlikely events that happen. As I've explained, this is not the company that you'd think that would end up producing this, but also the amount of hurdles that they had to overcome. No one had heard of them, so they weren't prioritized in Germany for getting supplies. They couldn't get the basics that they needed to run their labs in the early days. They were ignored by the European Commission for quite a long time, for several months, couldn't get the funding neither from the capital markets in February 2020, nor from governments in the months afterwards, to essentially build the facilities that they would need to produce the vaccine. And they had all sorts of other hindrances. For example, they only had, it's a small company, and they didn't have the level of biosecure labs to be able to handle COVID, so they couldn't test their own vaccine in-house because they didn't have the right labs. And the outside lab that they would have used, the company that they contractor they would have normally used, was in northern Italy, which was closed down because of COVID, because of a COVID outbreak. And so they had to come up with ingenious solutions, which there's a big story in the book about how they came up with a pseudo virus, etc., to be able to test it in the labs that they had. And all through this is just a series of incredibly unlikely events. And I mentioned the investors over there, two Bavarian billionaires, identical twins from Bavaria, who'd made their money in there 80s and who wanted something else to back, and who basically gave them an open check and told them, go with it. And the fact that they, had this ongoing flu collaboration with Pfizer and managed to get Pfizer on board, which, wouldn't have been possible with another company because they already had, a working relationship. It would have taken a lot longer to onboard Merck or someone like that. And so all through this, it's just a story of, as I say, serendipity and chance and luck, and all of the mechanisms that you think might have been in place. There's a advisor in Britain, a political advisor called Dominic Cummings, who was a very controversial political advisor to the Prime Minister. And he said in one of his committee hearings about COVID, he said, when you join government, you think that there's a door, and behind that door, there's a bunch of ninjas. And these ninjas, know exactly what to do when a situation like this happens. And he said the lesson of the pandemic is that there is no door and there were no ninjas. And I think the lesson of this book is, it took extraordinary individuals, not least Uğur, Şahin and Özlem Türeci, but also several other extraordinary individuals acting alone around the world to bring us this vaccine. And it wasn't the sort of adults in the room, so to speak, who, roared into action and brought us this vaccine.
So what are some of the special things about the founders and the company itself that cause them to overcome these myriad of challenges and obstacles and hurdles that you articulated? If you could narrow it down or distill something about the founders and the company that got them to the point to where they are now, what would those characteristics be?
I would say for Uğur, Şahin and Türeci, they are steadfast believers in the scientific method. Okay. And when I say that, I'll start with an example. It extends even to their personal lives. I was with Uğur one afternoon, and I was sitting next to him, and I look across at his computer monitor, and I realized that the font is tiny. I really can't read it. The resolution is tiny. And I said to him, Uğur, how is it possible? How can you possibly read that? And he said, he says nonchalantly, I've been training my eyes for decades. And what happened is he'd read an academic paper that said that if you strain your eyes, then for a certain period of time every day, then you can either prevent or postpone the degradation of your vision. And so he'd been sitting for years with one contact lens alternately out of one eye, and enduring enormous headaches. And his vision is still pretty much perfect as a result. And that extends to every area of his professional life as well. And people won't believe it when I say, these people said at the beginning of the year there would be a vaccine in a year. They believed that targeting the spike protein in the way that they did would work. They believed this technology would work. And they believed this technology would work, 30 years in advance of the rest of the world believing it. But I can tell you it's true because I sat with them and I sat with them right at the beginning where they were making these predictions, and all the way through they were proven correct. And even when the variants came out, and after the vaccine was out and everyone was panicking, they said, this and this is exactly how it's going to work. The antibody response is going to be weakened, but the T cells will be all right, and then we'll have a booster, etc. And they said all of this, way before everyone else got to this point, and they've been proven right again and again and again. And one of the issues I had was I was worried that people wouldn't believe this. People always used to ask me, when you were following them throughout this extraordinary year, when were the big hiccups? When did they think they were failing? And to be honest, there weren't really any, because they were always so unbelievably confident that this would work. And that, I think possibly for other people and for most of us, that amount of self-belief could be damaging. You need to allow some room for doubt and for self-doubt. But in their case, because it's based on science and based on facts, and based on empirical data, once they are convinced that the data shows X, there is nothing in their, fiber that stops them from believing it. And that's what's really extraordinary about them.
So I could imagine, and you probably know better than I do, that a lot of biotechnology companies, they have that steadfast belief in the science. Was their belief in the scientific method, was their belief in the technology so much greater than other biotechnology companies and was that a reason why they succeeded when so many others have failed?
Actually, I think that the reason why they succeeded when so many others have failed is because what makes them different to other biotechnology companies is, yes, they were committed to this technology, but they were also committed to loads of other technologies. So, unlike most biotech companies, which have one proprietary piece of tech, which they will insist on until the end of days, Uğur and Özlem picked, firstly within mRNA, various different platforms, some of which they developed themselves, some of which they brought in through the expertise of, for example, Kathleen Carrico and Drew Wiseman, who I mentioned earlier, but many others as well. And they ran them all in parallel, but they were also dealing with, and they still are as a company, loads of other technologies. So they were in effect hedging their bets. And the confidence that I mentioned, isn't a confidence that what they have will work for everything. It was a confidence that if they have an open enough culture and are open to, ideas wherever they may come from, and really it is wherever they may come from. I think there are people from 60 different countries in the company and from all different disciplines, then eventually they will hit on a winner. And what made BioNTech's vaccine so different to the others, some of which were extraordinarily successful as well, but some of which failed, was that they started with 20 candidates. They started with the most complexity you could possibly have. They started with candidates with using all of their different mRNA platforms, and alternatively targeting the spike protein and the receptor binding domain, which is the bit right at the top of the spike protein. So they were trying it all from the beginning. They put loads of horses into the race and took 4 into their phase 1 trial. So they waited until the very last minute to make a decision, instead of saying, this is the technology we have, and this is, the only horse we're going to enter into this race. So while I say they have, steadfast belief in their technology, that's true, but it's based on a realistic expectation of what the technology can do, and a realistic process of evaluating, how well various different technologies will work against this virus. But they knew that one of them would be successful, but they put in loads into the race just to make sure.
We're talking to Joe Miller. His book is The Vaccine, Inside the Race to Conquer the COVID-19 Pandemic. Joe, given the track record of the BioNTech founders, I'm certainly interested in any insight in terms of the future of the vaccine and the pandemic itself. Did he offer any insights in terms of what we can expect next in the next 6 to 12 months?
So I think they both expect, and again, I don't speak on their behalf, but they both expect as most of us do, for the virus to become endemic and for us to need regular boosters on the COVID vaccine, similar to flu. And their hope is that eventually we can have a multivalent vaccine, perhaps to include flu as well, by the way, and so that we have one shot a year, one mRNA shot a year. And in theory, and although we're still a while from that, given the sort of building block system that mRNA vaccines allow you to work with, you could add a bunch of different viruses in there and get it all done in one go. That's when it comes to COVID-19. Now, of course, there's a lot of interest in what mRNA technology can bring to other diseases, etc. And as I mentioned before, there was already an ongoing flu collaboration with Pfizer that's carrying on, and that will probably yield some result in the near future. And the company is looking at loads of other diseases, including malaria and even sclerosis as a possible sort of target for mRNA therapy. But I think that there's been so much enthusiasm about mRNA that people will need to realize that COVID-19 was an almost unique disease in that, and it sounds awful to say this given that millions of people died, it was a relatively merciful disease in that it could have been a lot more deadly, but B, a lot less susceptible to being targeted by a virus. The spike protein is so pronounced and so easy to target. Many diseases, as you'll know, don't have a common target that's as easy to pinpoint as COVID-19. So while the platform itself, has been vindicated, I think, people who are expecting that we now have a wave of mRNA pharmaceuticals overnight will have to be a little bit more patient.
Now, through all your reporting and time that you spent with the founders and the company, what would you say is the single biggest surprise that you had from this story?
The single biggest surprise is that it was successful. As I say, I myself didn't think it would be, and there was no reason looking at the data to believe that, that it would. But really, the single biggest surprise I had was that people who have a vision and who have a, steadfast belief in, again, a database belief in the technology, can actually, and I know this sounds trite, but change the world, in that I didn't really believe that the world worked in a way where even if 2 very bright people in a small city in Germany had the cure to COVID-19, or had the antidote to COVID-19, that they would be able to essentially move the world around them in order to make everyone realize that this was, the winner. And the fact that they were able to do that, and that, this was possible through really a load of chance encounters. Uğur, Şahin and Özlem Türeci got to know Katrin Janssen, who's the head of infectious diseases at Pfizer, who's also a German originally, and got on quite well, and had a relationship that was in a good place when COVID came around. The investors I mentioned, completely bizarre investors really for a biotech to have attracted. And all of the various people who I mentioned in the book, who all deserve a book of their own, who are the brilliant scientists who work on this, most of them didn't come from a mRNA background, certainly not. But some of them didn't even work in immunology. They come from all sorts of disparate areas, and some of them had reached dead ends in their careers. And they all came together to create this incredible moment. And you couldn't recreate that. You couldn't sketch that. There's no amount of, no think tank in the world could have brought together policies that would make that happen. There was something really just about, the alchemy of extraordinary individuals coming into a room and sort of working, night and day to push something out into the world and getting it done. And I just didn't believe, but perhaps call me cynical, but I didn't believe the world could work like that. And luckily for us, it did.
And my final question, what are some of your take-home messages that you want to leave with the Kevin MD audience?
The take-home message for people who, I know a lot of the audience is much more scientifically literate than me, but the take-home message behind this, I really think, is that so much of it is understandable. And what I mean by that is, there are all of these questions about, how did we get a vaccine in a year when it took 5 years for the Ebola vaccine, for example? How come an untested technology turned out to be ready just in time, in 2020? How come it happened in Germany and not in one of the big pharma companies, etc.? And I think these are legitimate questions, I really do. And some of them have not been, given the best answers by, public health communicators. And I think if you read this book, it kind of puts all of those pieces of the puzzle into place, and you can see how we got from Uğur Şahin sitting at a computer in January to that fateful day of November where we had an announcement of an efficacious vaccine, and it wasn't an easy route, and it wasn't a risk-free route, and it wasn't a smooth ride by any stretch of the imagination. But it does all make sense, if you get what I mean. There's no magic potion or kind of or hoodoo involved or anything like that. It's just an extraordinary story, almost too good to be true, but it is true.
The book is called The Vaccine: Inside the Race to Conquer the COVID-19 Pandemic. There's a link to that book in the show notes. Joe, thank you so much for sharing your story, time, and insight.
It's been a pleasure, Kevin. Thank you.